June is Men's Health Month, and right now I want to talk specifically about men's mental health, which, to be honest, is kind of a double taboo that we need to break. I'm joined now by Dr. Ila Sabino. She's a psychologist at the Tallwood Men's Health Institute, which is based in Farmington. We've talked about it before. So happy to meet you, Doctor.
So nice to meet you.
Yeah, glad to have you here. And I do want to start with the stigma that we're trying to break. Generally, people don't like talking about mental health.
That's true.
But even more pervasive than that to me is that men in general don't like talking about health of any kind, much less mental health.
Oh, absolutely. Absolutely.
And how much of a problem does that provide?
Well, I mean, it's a big problem because we know that men tend to die earlier than women.
Yeah.
We know that they die of a variety of diseases, many of which are preventable.
Yep.
So that's why we believe in the concept of having a Men's Health Institute to really do a better job taking care of our men.
How do you, okay, so how is the Institute sort of segmented out or laid out so that it can better sort of access the needs of men? So
we are a collaborative group of providers.
Yeah.
We have a variety of specialists. We have urologists. We have a psychologist, me.
Yeah.
We have endocrinologists. We have medical weight loss specialists. We have all kinds of specialists, and we're all under one roof working together to provide good care for our patients.
And so, yeah, if guys don't want to come in, the idea is you go in and can try and get 3 or 4 problems taken care of all at once.
Absolutely, all under one roof. That's right.
You need to know about the problems. So tell me about the checklist that's often provided at Tallwood and how that helps you.
So when a man comes to visit us for the first time, they'll fill out our men's health checklist, and it asks about a variety of issues, and one of those issues is, do you have any mental health concerns? And
yes.
And if a man checks that off, they are referred to our nurse coordinator, who will reach out to them to see if they want to come see me.
We were talking about this before. That seems like a very broad question that it wouldn't necessarily catch guys in, but it does.
Well, it does because, you know, because it's so broad. You'll capture someone who might be struggling with depression,
yes.
or you might capture somebody who's struggling with anxiety, or you might capture somebody who's having a really hard time coping with a new medical diagnosis. So it was really broad on purpose so we could capture a wide range of people.
And to put a finer point on this, I did speak to one of the urologists there at the Institute many months back. He told me a story of one guy who came in for a urology problem, but then because of that questionnaire, or I believe something he had said in passing, that raised red flags that they found out he was depressed to the point of possibly being suicidal.
Yes.
Never would have mentioned it without that simple question.
That's right. That's right. And our doctors are really attuned to these issues. So I get, even if they check no on the checklist, but just like you said, they
yes.
say something that sounds concerning, or they'll mention that they're fatigued, that they're not sleeping well, maybe they're drinking too much. Our doctors are listening for that, and they will send them to me, hopefully, and they'll agree to come.
Right. That's the idea. In closing, just talk to me in general terms about how much more of a problem mental health seems to be for men than it is for women.
Well, it's a big concern because we know that because of the stigma of asking for help or expressing
yes.
A need in some way, men are very worried about being perceived as weak or ineffective or broken. And because of that, we know that men are 4 times as likely to die by suicide.
4 times.
4 times as likely to die by suicide as women.
Yeah.
We know that men are much more likely to use illicit substances, all substances. We know that men are more likely to die of a substance-related overdose or show up at the ER. We know that men are much more likely to commit to commit violent crimes, to be victims of crimes, and so we're really trying to reach out and do a better job.
I mean, across the board, guys, we got to get it going, because we are just seemingly at risk for a whole wide range of things. A lot of it due to that stigma, due to this idea that we have to be the strong, silent type, and that's where people like Dr. Sabino and the Tallwood Men's Health Institute are certainly trying to make some strides. So thank you for trying to shine a light on that, Doctor.
Thank you so much. Thank you.
It's a pleasure to have you here.
Pleasure.
Oh.